is PRP and how does it benefit?
Your blood has certain cells, white bloods, red blood cells, then platelets. I would not say that it has helped a lot to many people.
Only
Only PRP.
PRP.
Somebody is having very low platelet count and also some bleeding disorder or coagulation disorder, we would not suggest PRP.
Is your hairline starting to fade and you are looking for a natural solution to restore it? Friends, as we know, PRP is making waves as one of the latest treatment for ongoing hair fall and hair loss. So, is PRP the answer you are looking for your hair fall? Stick with us in this special episode of podcast where we are going to dive deep into the field of PRP and we will share the information about PRP. But before we actually start with the podcast, if you want to keep yourself updated about all the latest information in the field of hair loss and hair transplant, medical treatments, and everything about hair loss, we request you to hit the subscribe button. And even for more, you can hit the bell icon to get the notifications first. So, to discuss this topic in detail about PRP, we are going to have this discussion with Dr. Preeti Saraswat, who is a board-certified hair restoration surgeon and in this field for almost a decade now. So, welcome to this episode, Dr. Preeti. So, first of all, please discuss what is PRP and how does it benefit patients who are having hair fall or hair loss?
PRP has been around for some time now. PRP stands for platelet-rich plasma. What is plasma? Plasma is the liquid part of your blood. So your blood has certain cells, white bloods, red blood cells, then platelets, and then the liquid part in which the cells are present. So if we derive that plasma with a greater concentration of platelets only, discarding the white cells and red cells, then what we have in our hand is PRP. So it has been used in various other departments, specialties in medical field for a long time. But now we have discovered that it is useful in field of hair loss also. So that is why PRP is much of a rage now. Many people are opting for it. Many centers are providing it.
How do these platelets in the PRP stimulate the hair growth?
So the platelets, when they are in plasma, they are a big bank or source of various growth factors which help in growth of strands or roots of the hair which are damaged or which are undergoing androgenetic alopecia problems and so.
So what kind of hair loss do you think is the one which responds to the PRP therapy most?
So because the PRP when we give, it gives a lot of growth factors locally on the scalp. So the major beneficiaries are, I must say, androgenetic alopecia people only, the main female and male pattern baldness.
Okay. So
But sometimes, these are the commonest people who get benefit. Otherwise, doctors have tried this for alopecia areata also, but not of much use.
it's not that effective as in the
Yes.
male pattern or the androgenetic alopecia. Yeah, so we request you to like the video, and if you like other content on our videos or the channel itself, we request you to like this video also. So now, Dr. Preeti, one more thing we want to know about is how much time it takes for the PRP to show its effect.
So see, there is not very strong protocol for it, but when there was a conference, one of the World Congress in which it was talked upon a lot, and then a consensus was made that PRP for hair loss, when it is given monthly for 4 sessions,
Okay.
then we should review the growth of hair after 2 months of last PRP.
Okay.
So we start giving PRP monthly for 4 months. Then at 6 months, we should call our patient and review how the
Yes.
growth has been. And then he can opt or she can opt for PRP according to the benefit, once in 2 months, once in 3 months, or once in 6 months as a maintenance therapy,
Maintenance therapy also.
whatever is required.
If you are also looking out for PRP therapy, you can mention in the comment section below in this video and we will try to answer those questions also. So, Dr. Preeti, you're doing almost 4 or 5 PRPs a day with your team. And are there some good success stories and patients who are very happy with these results? What kind of results people get Is this something you would like to tell us about?
See, PRP is opted by people. See, we have a consultation with the patient, whoever comes for hair loss. We tell them all the medicines if they need them, and also the options they have, the therapies options they have. PRP is one of the options for therapy. Here at our center, we combine PRP with low level laser therapy and derma roller at the same time. So, in one session, we give the low level laser therapy first, then we give the local anesthetic cream, let it sit for around 30 to 40 minutes, give them a good head wash, then we do a good derma roller as per the protocols which we have taught our therapists, and then we give the PRP injections to the hair loss patients. Now, per se, only PRP, I would not say that it has helped a lot to many people.
Only
Only PRP. There have been a few instances when some teenager, like I would say 19, 20 years old boy, he was there and he didn't want to take anything except for PRP. So we said, okay, let us try PRP first. And he was benefited by it.
Okay.
So here and there a little.
The mixed
some
sort of responses
examples,
to
yeah.
PRP alone,
PRP
but they
alone.
work better with other things.
It always works better with the US FDA approved medications along with a good diet, and then it works best.
Okay, so if you're looking for hair loss treatment and you want our help or you want to get an appointment with us, you can contact us on the numbers mentioned on the screen here, and or you can WhatsApp your pictures and then you can book an appointment with us to get these medical treatments and therapies like PRP with us. So coming to the safety aspects of PRP, how safe is PRP and are there some side effects of PRP?
In general, I would say PRP is a safe procedure. But I have seen a few patients, they feel a bit pain when PRP is done or after PRP. So those are those people who are very sensitive to pain. So in that case, we can give a painkiller after some time if required. Otherwise, we use a very good vibration device. We also sometimes do icing so that pain sensation is felt less. So you know that there is a cool ice tip vibrator also, which we use. So that is for the same purpose. Otherwise, there have been very occasional cases of frontal swelling.
Swelling with that.
So,
but in general, it's very
in general, it is very safe, and there is no such a side effect to be seen which may hamper anyone from coming from PRP.
Now, would you like to tell us if somebody is not a good candidate for PRP, who are those kind of patients?
There are usually people who we would not suggest undergo PRP are those who are having folliculitis on the scalp. You see some lesions are there, local infection is there on the scalp. Then because if we do the PRP, then it may spread. So they are not good candidates. We have to treat that first. Otherwise, if somebody is having very low platelet count and also some bleeding disorder or coagulation disorder, we would not suggest PRP because in that case, the error would be there in the making of PRP also and injection.
Be effective also. If you want to know how the PRP is actually done, you can click the link given above on your screen to know more about the way it is prepared and injected. Now, if you compare PRP with hair transplant, how would you compare them? Because there are patients who have absolutely no hairs and they think that they can grow hairs back with PRP itself. So
they think PRP is some magical solution which will grow hair out of the body scalp. No, it's not that. It's never true. PRP and hair transplant are very different things. In hair transplant, what we do, we take your grafts from the donor side and we put them on the bald side and they start growing. It's not as simple as this, but yes, this is the basic line for it. And in PRP, we make the PRP solution, the solution having lots of growth factors for hair roots to be benefited from your blood. So PRP will help you only if you have hair roots.
Hair roots, exactly.
So
and they're thinning.
That is why in androgenetic alopecia it helps because there is a problem called miniaturization. The hair roots are thin, they are weak, they come out easily. The anagen phase is reduced very much.
The growing phase,
The growing phase, yes. So if you have a root which is weak, PRP will help you. Hair transplant will help you if you do not have root. So these are very different things.
So when we compare PRP with other treatments like minoxidil or finasteride or mesotherapy, what are your thoughts about comparative efficacy of all these treatments?
Minoxidil and finasteride are US FDA approved treatments for androgenetic alopecia, that is male and female pattern hair loss. PRP is not US FDA approved, first of all. So, if we want to have a proper medical therapy, we should go for minoxidil and finasteride. But if we want to give extra nourishment and boost to the growth of hair, we should come for PRP.
But in general, we
Together,
advise PRP along with medical.
yes, together they work best.
Very nice. Okay. They work best when they are done.
When they are done together. Apart from PRP, there is one mesotherapy also. In mesotherapy, there are pre-made cocktail solutions of growth factors. So we can do PRP or we can do mesotherapy if the patient does not want to give blood for PRP preparation. So mesotherapy can also be done along with PRP.
So coming to almost the concluding part of this podcast, do you think PRP is a long-term solution for your ongoing hair loss of any patient along with other medical treatments?
I would say PRP is a maintenance solution along with other medical treatments. So, if the patient is taking medical treatment properly, they can take PRP as a maintenance therapy off and on as per their doctor consultation.
Right. Thank you so much. So, hair loss can sometimes feel very overwhelming. People become very much disturbed, especially if it is happening at a younger age, as we are seeing now more and more. People in their late teens or early 20s are having a lot of hair fall, hair loss, and because of a lot of factors, environmental, stress related, diet, and their lifestyle, along with the family traits or genetics of their hair loss. So, it's nothing to worry that much about. There are a lot of treatments, medical treatments, PRPs, mesotherapies, as we have seen in this video, and where a lot of questions were answered by Dr. Preeti in such a nice way. So do not be disheartened. There's a lot of hope for people who are having such kind of problem. We request you to consult with a good hair loss practitioner in your area. Preferably, they should be ISHRS members or AHRS. If you're in India, then there is a local Indian organization, AHRS, ISHRS, or American Board of Hair Restoration Surgery. These are people who have invested a lot of time and their efforts. They're keeping themselves regularly updated about all these treatments at regular interval. So nothing to lose hope about. And there is it's a very positive outcome which you can achieve by following these treatments after consulting with your board certified doctor. And please do not forget to share this video with people whom you think will be benefited by this, who are looking out for medical treatments for their hair loss problem. If you want to know whether PRP will work for you or not, please click the video on the left. And if you want to know top 5 myths about hair loss and the debunking of these myths, please click the video on the right. Thank you. Thank you very much.